Welcome to the Tai Chi for Recovery Legacy Project. And today we're going to walk through the history and the foundations of this project. To understand how Tai Chi for Recovery was born, we have to go back to Gichin Funakoshi of Okinawa. He was my first sensei. He died in 1957 and is considered the father of modern karate. He founded the style Shotokan, and the symbol of Shotokan is this rising sun. Also, this Shotokan tiger is another famous symbol of Funakoshi's karate. Shoto was our founder's pen name and means pine waves. Just like Tai Chi, in the early days in Okinawa, Shotokan karate was practiced in large groups in temples. Karate is a martial art of an open hand, empty hand. So even though once you reach black belt or first dan, you train with various weapons, it is essentially a hardstyle martial art using no weapons. My journey with martial arts began in 1977. It is important to understand the lineage of my Tai Chi, my martial arts journey, in order to avoid any appropriation. One of my first senseis was Kanazawa. Kanazawa was sent over from Okinawa by his sensei, Funakoshi. For many years, Kanazawa was in charge of the Shotokan Karate Do International Federation. This is a brief summary of Kanazawa's life in karate. As you can see from the summary, Kanazawa was very interested in Tai Chi. And the picture that you saw of him in the previous slide is a famous Tai Chi move, snake creeps down low. So you can see that my earliest influences in hard-style karate also included Tai Chi. In fact, many of the advanced karate, Shotokan karate, katas or forms include slow breathing and Tai Chi-like moves. Sensei Anaida of the KUGB was also one of my early senseis and another martial artist deployed from Okinawa to bring the art of Shotokan to Great Britain. Lastly, Sensei Asano of Shotokan Karate International Great Britain was influential in my training. On a daily basis, my senseis were from Britain. My father, a famous martial arts fighter, Sensei Michael Baxendale, and his colleague Mike Smith, shown here in Gleadless Church, Sheffield, England. The time of my father's death, he had reached 5th Dan in Shotokan Karate. His opponent there, who he is shown striking, Mike Smith, is alive and well today and lives in Sheffield, England. Another influence on my training and martial arts development came from Sensei Paul Groves, also alive and well today, still training in Skegness, England. So the people featured were the heavy influences on my martial arts. And you can see that I started karate at the tender age of 7 and was involved in various federations and martial arts associations with the Japanese instructors shown. By 1987, at the age of 17, I had reached second dan black belt, was ranked third in kata in England, and had received lots of media attention for my martial arts. In fact, at just age 15, I had opened my first dojo. I continued to train while I was at the University of Sheffield, and a few months after graduating, I emigrated to Michigan in the United States, leaving Sheffield, England at the age of 23. Not able to find any Shotokan instructors in my locale in mid-Michigan, I found Sensei Eric Redinger, who awarded me third dan in an American style of karate called Jindo. Eric Redinger is alive and well and lives near Big Rapids, Michigan. As a seasoned martial artist and competitor, I began refereeing national and international competitions in the UK. Shown here is a competition in Hastings, Michigan. So you can see that I continued to referee when I came to the United States. In the United States, I trained at and established various dojos. This is the slow community advocacy work of karate, building up martial arts studios by establishing several times a week of children and adults classes. I had the opportunity to participate in a cage fight with Sensei Mark, and this was a demonstration of karate do before a mixed martial arts competition in Sheboygan, Michigan. Shown here with Sensei Eric Redinger again. This is a dojo that we established in Petoskey. And as you can see, we had good numbers there. And this dojo was well established by the time I moved up to the UP, to Marquette, Michigan. I participated in various dojos while I got established in Marquette, Michigan, and in 2015, I founded Vibrant Health Company, where I began to integrate my knowledge and experience of martial arts into my private practice. First of all, I established the brand Fight 101, a personal safety or self-defense course that was trauma informed, which made it quite novel. So we launched a Stop Sexual Assault campaign and integrated the ideas of consent and trauma prevention with martial arts self-defense. We held classes and workshops at various places around Michigan and beyond. And what follows now are a few slides showing different places that we did that in the UP. We also ran this class for different corporate events, and even our children were involved in this project. So shown here is Kate and Andrew, now married, our daughter and son-in-law, and they posed for the pictures for our very first Fight 101 handout, which was a pictorial guide for participants to help them understand the attacks and defenses. Shown here is Jack, another one of our children involved in teaching and posing for some instructional videos.
The last thing that I'm going to talk about in this video in terms of flaws of self-defense courses that are not based on real life self-defense is that they teach brand new people to throw the perpetrator over themselves or over the shoulders. This is a very bad idea. First of all, it takes good technique to be able to throw somebody bigger and stronger than you. Second of all, if they've got a hold of you or are choking you around the neck, you're going to go down to the floor with them and end up in a far worse situation grappling with your attacker on the floor. So if you go to a self-defense course and they're going to try to teach you to throw this person, what we're going to end up doing is seeing people struggling like this, trying to get this person on the floor. As a trained martial artist, it is quite easy to throw a bigger person. There are lots of little tricks that we know how to do to get behind them and take their legs here, and here on a pressure point, but that is not something that even I would do in a real self-defense situation. So let's take a look at real self-defense. Good?
So as you can see, we like to keep it real with our self-defense course, and we don't teach anything that we think somebody is not able to do after coming to a self-defense course and practicing that move in the class. So we like to keep things very simple and straightforward. This class was held at Peter White Public Library in Marquette, Michigan, sponsored by Single Track Health. Thank you to Dr. Stillin. Another well-attended and fun class. And this shows that teaching self-defense in a trauma-informed way can be a lot of fun for participants. So while this class was taught as a community class, and we took it on the road. This one is in Petoskey, Michigan. I did continue to teach elements of self defense within my private practice, specifically to survivors of sexual assault and IPV. So this skill came in very handy to integrate into my clinic. As word of this self-defense class, Fight 101, spread around Michigan, we were invited to several statewide conferences to present on trauma-informed self-defense. And of course, this is me feeling quite empowered. Just before I was scheduled to speak on stage in Detroit, Michigan. We have enjoyed large crowds and robust audience participation in these Fight 101 campaigns. We had a lot of fun doing this. So, as I became established in Marquette, Michigan, I had taught at the Y for a number of years, and you can see that I maintained this hardstyle martial arts, low stances, bare feet, strong movements, and I began to teach their children's martial arts program. So I did teach traditional Shotokan karate. You can see the kids here are wearing their white gis, and as is required in our art, we trained in bare feet, unlike the kickboxing classes that I had taught here and at various other places where we were allowed to wear shoes. So we had many children enrolled in this traditional Shotokan karate dojo and had a lot of fun with that. But unfortunately, by this time, the wear and tear of hard martial arts, especially training in bare feet and locking out joints, was beginning to take a toll. And the arthritis in my hips was telling me that I better figure out something else to do with martial arts if I wanted to stay active in it for most of my life. Already been influenced in Eastern traditions and Taoism, and as you can see, exposed even as early as 1977 to the ideas of Tai Chi from one of my senseis, Kanazawa. I decided that I was going to invest in learning Tai Chi. I chose Dr. Lam of the Tai Chi for Health Institute as my main sensei, master, and mentor. And that was because at the time, and this is still true, Dr. Lam's organization was the most well known and most well respected organization formalizing Tai Chi, especially Tai Chi taught in community classes and for recovery. So this is one of my first Tai Chi instructors that certified me to teach Tai Chi for arthritis, Becky Ray. And I took this course in Nagani and continued my training with another Upper Peninsula master trainer, Anita Carter, pictured here. So as a seasoned martial artist, now transmuting into almost exclusively Tai Chi, and having many, many years of yoga experience, I immediately implemented Tai Chi and Qigong into my private practice, using it as somatic work for relaxation and healing. Just as I'd been used to speaking and training on the road, I began to look at the science and research behind Tai Chi and Qigong and speak about the effects on the autonomic nervous system, particularly when we look at aspects of trauma recovery. From a social justice perspective, I wanted to bring the art of Tai Chi and Qigong to more people, firstly in our local community, Marquette. And so I collaborated with the local women's center and uh, starting with a pop-up workshop, which would later become a Friday night free class, then began teaching community and therapy groups for Tai Chi and Qigong. Already vetted as a group X instructor at the Y, they let me start Qigong and Tai Chi classes several times a week. And so shown here are a few groups of my first students. You can see on the far right there is my husband and business partner, Rob, began Tai Chi in the early days. And some of these people still train that you're going to see here on the pictures. So, as well as the Women's Center and the Y and pop-up workshops and speaking events, basically all over the place, we also had a Sunday class at Be Well here in Marquette. I taught various classes at Northern Michigan University, taught on a retreat for Khalil Zenda, and began to really integrate the Tao, our outdoors, into my Tai Chi practice. I went on TV6 very early in the morning to talk about being a third generation martial artist and my hopes for Tai
This
Chi.
morning, we are talking about the benefits of Tai Chi with a licensed martial arts instructor, Tracy Baxendale Ball. Thank you so much for waking up with us this morning.
Good morning.
So, we're going to be really diving into the practice of Tai Chi, but first, talk a bit about your background. And you have a very extensive background.
Yes, so we're going on 5 decades in martial arts, and I'm a third generation martial artist. So I currently use that experience to teach all kinds of things, kickboxing, Shotokan karate, self-defense, and then Tai Chi is a new addition for me. It's something that I've wanted to study for a long time. But as I'm aging gracefully and my practice is also aging, I found Tai Chi to be a beautiful addition.
So when you wrote to me about Tai Chi, you said you love the beauty, grace, and mindfulness-based serenity of the practice. Explain what Tai Chi is all about.
Yeah, it's it's something that is gorgeous to practice. So while it's based on martial arts, really these days it's being adapted as a practice that combines three main elements. The first is you train yourself to be in a high state of awareness. The Western word for that would be mindfulness. The Chinese would say Shengang or Zanshin in Japanese. So a high state of awareness with beautiful fluid movement that is scientifically proved to massage the internal organs, and then breathing or qigong. So we have the three elements, the awareness, the qigong, and the movement, all working together to produce this lovely flow of qi or life energy around the body.
So we don't want to just talk about it this morning. We want to see a little bit, and I wish we could play the music that goes along with it, because I'm sure that's an important element. But show us a bit.
Okay, so
we have about a minute left.
We have a minute, so
Yep.
I'm just gonna show you how to sync the chi, we call it, and then just do a few movements. So.
Perfect. I'm gonna step up to the side here. I'm gonna give you some space. All right, I don't want to break your concentration, but I can really hear your breathing. And like you said, that's such an important piece of that. Much slower, much more flowy than I realized it would be.
Yes, that's right. So what I'm doing here is I'm using empty legs to step carefully, which is why this is a evidence-based practice for falls prevention and arthritis. So this empty leg is my grounded and rooted foot. And then I'm using my arms to compress the breath and expand the breath, which is in turn massaging my internal organs, which is preventative and curative for disease.
All right, Tracy. Well, I want to thank you so much for joining us this morning. This was a really wonderful demonstration.
Thank
Alyssa?
you very much for having me.
Let's find out what they said about that when they came back from that segment.
Good Wednesday morning to you. I'm Elizabeth Peterson.
And I'm Alyssa Jawar.
Thanks for joining us this morning. After we had that Tai Chi lesson, I feel a little more zen. And Jennifer, it's going to be one of those days to just take it easy.
So the Tai Chi community practice has grown alongside of practicing mostly Qigong at the clinic individually. And you can see various places that we've had community classes here. This is Chicago. We held a once a month free Tai Chi and tea practice at our local food co-op. This is another conference at Northern, and some photos taken on location at Be Well. So you can see that even though I have different martial arts integrated into my practice, for the most part, I do continue to wear the white gi of my mother art, Shotokan, especially for official photo shoots, just to show the lineage of my own martial arts. A couple of years ago, we started to participate in the Global World Tai Chi Day and held our first large community event at the library and invited other area instructors, notably Cedar Tree Institute instructors John and Diana Magnuson, to participate and teach with us. We've had a lot of fun reaching different community populations with Tai Chi and Qigong at these various events. Two 2024 was a seminal year for Tai Chi. Firstly, we applied for the official trademark for Tai Chi for Recovery. As of today's recording, it looks favorable that this trademark will be awarded in early 2025. We certified our first two Tai Chi for Recovery instructors, Audrey Waterman and Kim Krulik. We continued to reach community groups through events like World Tai Chi Day. And we continued collaboration with other area holistic healers such as Mark Weinrich. In 2024, I traveled to Oregon to meet Dr. Paul Lam and recertify as a Qigong for Health Institute instructor. I was also in the first group in the world to receive the Dancing Tai Chi certification, a certification which combines the mastery of Tai Chi with the art of dance. You can find a video on my YouTube channel that shows you the premiere. I also traveled to New York to talk about the launch of the Tai Chi for Recovery project and the research behind its healing effects. While I was in Buffalo, New York, I was awarded the Medical Tai Chi Qigong Instructor Certification by endorsement from the International Medical Tai Chi Qigong Association. In achieving this honor, I became one of the first of 10 instructors to receive this endorsement in the world. This endorsement not only speaks to my practice and advocacy in martial arts and Tai Chi, but my deep understanding of the effects of Tai Chi and my ability and commitment to teach it safely. My advocacy for martial arts and Tai Chi, especially in the world of recovery, got me noticed at Barry University, where I'm currently in the final 6 months of my doctoral program. Also, in 2024, I published my first peer-reviewed article in the National Association of Social Workers Aging Journal. In 2024, I took to the road to begin promoting the Tai Chi for Recovery brand. I spoke to small groups such as ACT and IDDT teams, as well as giving lectures and workshops at large statewide conferences. Towards the end of 2024, I trained 2 new Tai Chi for recovery instructors who will take their certification in early 2025. William Sharp and Aaron Middleton, shown here. As you can see, the Marquette Tai Chi Club has continued to grow with slow and patient nurturing. Shown here on the front row to my left are Charles Gorton and Melinda Benninger. In the middle behind them is Shayna. These 3 individuals have expressed interest in becoming our new community Tai Chi instructors. And like Will and Aaron, will take their certification to do so in early 2025. As part of our Tai Chi for Recovery movement, it's important that you know our future plans for Tai Chi. What will 2025 bring? First of all, as our Tai Chi for Recovery trademark comes through, our goal is to launch the Tai Chi for Recovery program. The Tai Chi for Recovery program will focus on medical Tai Chi, specifically to heal the effects of complex PTSD with comorbid addiction and medical issues. Along with the Tai Chi for Recovery program, which will be open to medical and allied professionals, we will certify more program instructors as previously described. The certification program for community instructors is going to be by endorsement and is only available to Tai Chi students or Budokai that have trained with me for over a year. By the end of 2025, we will launch a certification program for medical Tai Chi instructors. This will mean that individuals that are current medical professionals can begin to teach medical Tai Chi and Qigong in their current workplaces or establish classes in their community. This might look like one-on-one practice or therapeutic groups. These therapeutic groups or one-on-one practices are going to be relevant for many different kinds of sites, such as justice-involved clients, jails and prisons, inpatient hospitals, rehabilitation centers, wellness centers. We will launch our first pilot program in Marquette, Michigan, our global headquarters. Also, by the end of 2025, we will publish our first Tai Chi for Recovery book, which will be a handbook for those hoping to certify as instructors. Please join us in our efforts for social justice, bringing Tai Chi and Qigong to the masses. Thank you for your attention today.